Hello, my name is Jaden Ramos, and my topic is on euthanasia, specifically physician-assisted suicide. Physician-assisted suicide is the act of giving a patient being received a lethal dose of drugs. This patient has a terminal illness such as cancer or Alzheimer's, something that cannot be cured, and the patient is always confirmed to die within the next 6 months or so. This would end their misery and end their agony. This ideology is called the right to die. People who believe this movement are the right to die movement. PBS states in 2012 that the leader of this movement, Derek Humphrey, in 1980 started the movement when his wife had breast cancer and she was dying from it. He aided her in her killing herself. PBS also states that in 1990 the movement continued with Jack Kevorkian, also known as Dr. Death, who had devised a machine that would help patients in a hospital self-administer a lethal amount of drugs to them, which would in turn kill themselves. The movement also continued years later, through the baby boom generation. As they grew older, they were faced with these options of whether they want to be euthanized or suffer through their agony and misery. On a more personal level, this is a decision that we may have to face one day. It's important to us, maybe not now, maybe not 10 years, 20 years from now, but in the future, there's an option that we may have to consider ourselves. It's not a matter of it being imposed onto us, but us having that liberty, as it is our own bodies and our own right to if we want to have if we want to have a painless death free of agony and misery, we should be allowed that as a right. Also, the fact that we don't want to have a burden on our own families. Perhaps you're in a state where you aren't helping, you don't have a purpose anymore. As grim as that sounds, you are basically burdening your family, whether it be because of this or because of that. You feel like the best option would be to just end the pain and end the misery, not only yourself but also your family. Going back to it being your own right, it is your own right to end your pain and end your misery if you choose to. You have a right to a dignified death. Nor the government, nor doctors, nor anyone should have a say in whether or not you should suffer or you should die. If you want to have that painless death, dignified, where people remember you as who you were, you should have that right. Not only should you have that right, it should be legalized in the United States. So not for it to be imposed, we should have that option. As well as if you feel like you're a burden to your families, you should have that option to be euthanized. Speaking of families, you may feel like if you're in a position, it could feel like that you're a burden to your families, whether it be financially, whether your family may not have the income to keep you alive, or whether it be time constraints, whether people don't have the time between work, school, family time, whatever it may be, to check up on you and make sure you're good, and to keep checking up on you, and you feel like at a certain point that you want to be euthanized so that you could have that painless death and lift the burden up from your family. Now, a problem with this that many people who oppose the right to die movement come up with is saying that a person can be coerced into being euthanized, that maybe a family member or a friend or a doctor may impose it onto them and may urge them to not be a burden per se. Well, in 2016, according to the Issues and Controversies page, in California, a bill was passed to legalize physician-assisted suicide, but also with that, it was made a felony to coerce anyone into persuading someone to kill themselves. Now, to conclude, it's a matter of your own body, your right. As we grow older, as we go through these changes and have these diseases and may face these health issues, we have the right over our own bodies to decide if we want that painless death or not. Now, not for it to be imposed, not for it to be pushed onto you. It's not a mandatory thing. It's if you want it over your body, you have that option. If you want to suffer or ride out, you don't want to take the premature way, that's completely fine. It's just a matter of you having the option to go painless in a dignified way. Not only that, for you to not have a burden on your family, so you not to be a burden anymore, to you to help your families out in that sense, where they don't have to invest the resources, the time, the energy, whatever it may be, to help out your family. That's the main point of it. Thank you very much.